Hey everybody, Luke Gordon here, and we're talking about inversion tables again in this video. And I've got a couple videos on the topic already, how to use an inversion table for lower back pain and sciatica, and just overall if inversion tables work for that. So I'm not going to go into those details on this video, but I do want to talk about if you're using an inversion table for your lower back pain specifically and or your sciatica pain, how long you should be using it. So in this video we're going to talk about how long to use the table, as well as some other strategies for if you're first starting to use it, how to kind of ease your way into it, and then ultimately how to build up that time, and some other strategies you can use too, such as going back and forth. So I've got my friend Stretch here on the table. He's going to help me with the video. This is Stretch Armstrong here, and so we're just going to dive in and look at how to start using an inversion table. First off, you should have it set for your appropriate height. That way you can go back and forth on your own. Although certainly if you're brand new to the inversion table, it doesn't hurt to have a friend or someone who likes you and would flip you back up if you went too far. So when you first are using an inversion table, you just want to go back not very far. So I have the cord set on here. That Stretch will only go back about 45 degrees or so. So that's the first thing you want to make sure you're doing in terms of trying to increase your time. Is the first thing that I would do is start by only going back about 45 degrees on your table. So that's the first thing I would recommend, is don't go back too far. So usually what I do for people in the clinic then is I put them on the table. I'll show them how far I'm going to have them go back just so they can see it. Because oftentimes you'll feel like you're going back farther than you actually are. And then I'll put them on the table and I'll help them tip back. Usually I'll instruct them to raise their arms just to start offsetting their balance and tipping back slowly. I'll make sure they don't go back too fast. But then I'll have them go back just to about flat. So just like 0 degrees, completely horizontal. And then I'll tell them, you're flat right now. And they'll usually say something like, wow, I feel like I'm already tipping back. So just so you know, get your bearings a little bit if you're just trying the inversion table, and again, you're looking to build up your time and your tolerance. Just see what it feels like to go flat first. Then, very slowly, start to go backwards. Hopefully Stretch stays on the table here. And again, let's say you're going to about 45 degrees is where your table, either your cord or your bolt, whatever your table is set with for those degrees, those angles. Just go to 45 degrees slowly and stay there. And I would say stay there for somewhere between 1 minute and 3 minutes, and then just come back up to neutral. So that's day one. So again, if you're asking yourself, how long can I use the inversion table? When you're first starting off, just do about 3 minutes that day and just see how you feel. Come back to neutral for a little while. Maybe don't even come back all the way sitting up for a minute or two, because as you come back up, as we bring Stretch back up here, his spine, which we were just lengthening and stretching out, is now compressing again. And sometimes at first, when you're first coming back into a gravity-dependent position and your spine is recompressing, that can hurt. So how long can you use an inversion table? At first, just use it for about 3 minutes. And then just see how you feel. See how you feel later that day. See how you feel the next day. And the next day, if you want to go a little bit longer, what I would recommend is stay at about that 45-degree angle, but go longer. And this time go for about, let's say, 5 minutes. Or what you could do instead of going one time at 5 minutes is you could get back for, let's say, 3 minutes again. Come back to neutral for just about 1 minute, and then go back and do 2 or 3 more minutes at 45 degrees. And then again, when you're coming back up, maybe stop at neutral just for 30 seconds to a minute, and then come all the way back up and slowly let your spine recompress. So that's taking you through what I would recommend for days 1 and 2. Again, start with just 3 minutes on day 1, build it up to somewhere between like 5 and 6 minutes on day 2, and consider that break in the middle. And then ultimately, over the coming days, let's say the period of 5 days, you can gradually work your way up to 10 to 15 minutes. And depending on what's causing your back pain, you might actually feel better doing it a little more intermittent, like I was just doing. Go back for 3 or 4 or 5 minutes, come back up to neutral for a minute. Go back for a period of 3 to 5 minutes, come back up. So there is some experimentation involved there in terms of what feels better. And it can depend on your diagnosis too, if it's more of a degenerative joint disease versus a disc disease or a bulging disc, things like that. So do some experimentation with that. One thing I should probably say before I go any further is that if you do have any serious back pathology, such as a fracture, spondylolisthesis, previous fusion, something like that, I would definitely consult with your medical provider first. So please don't, hopefully I should have put that at the beginning of the video, but don't skip that step. If you have questions and you don't know if an inversion table is safe for you, then please don't just dive in. Check with someone first who can instruct you on that a little bit. Okay, so that kind of covers this video then, is how long should you use an inversion table. Ultimately, as long as you're getting good results in those first period of days, again, day 1, 2, all the way up through day 5, where you're building up to about 15 minutes total, that's where I would have people land. And if it's well tolerated and you feel good, you could certainly do that multiple times a day. Just build that tolerance first. The last thing I need to mention then too is that once you're comfortable at that 45-degree angle, then I would start to experiment with going back farther, like to 60 degrees, 75 degrees maybe. Ultimately, there are people who can get completely upside down, completely inverted, but you just want to build your way up to that and make sure that you're listening to your body as a result of that. So that's my advice on how long you should spend on an inversion table. And again, just make sure that you are gradually building your way up and listening to your body. And if you have any serious medical conditions that you need to get cleared first, please talk to your doctor. Especially if you've had like a back surgery, you've had any advanced imaging that shows things like fractures or spondylolisthesis. So that's my video for today on inversion tables. Thank you for watching. Please feel free to leave me a comment below. I appreciate any feedback you have on my videos, and I'll see you again next time.